In this final video, we will be discussing the progression of COVID-19 and the conditions that affect the infection outcome or prognosis. This figure from the WHO shows the progression of the illness. Mild to moderate cases make up 80% of all disease, and mild cases rarely progress to death. Moderate disease and severe disease more commonly progress, and patients who are critical, like our patient, have a high chance of dying, 22 to 62%. Critically ill patients may develop septic shock with organ failure. This syndrome may be associated with high levels of cytokines, including interleukin-6, as seen in the case I presented, and is termed cytokine storm. The average duration of hospitalization was 12 days, 11 days for non-severe cases, and 13 days for severe cases. Mechanical ventilation was required in 38% of severe cases. In the New England Journal series, death occurred in 1.4% of cases, with a 0.1% mortality for non-severe disease and 8.1% for severe cases. The case fatality ratio reported by the WHO was 3.8% in China. Case fatality, or CF, is defined as the number of deaths divided by the total number of patients with the disease. This percentage may be an overestimate because milder disease was not always recognized, lowering the denominator. The case fatality rate will also be higher where care is limited. Given these limitations, experts estimate that the case fatality rate is somewhere between 0.5 and 3.5%. To put this in perspective, influenza's case fatality rate is 0.1%. Therefore, the case fatality rate for COVID-19 is 5 to 35 times higher than seasonal influenza. Mortality is related to the sex of the patient, men having a higher mortality than women, as do patients with chronic illness, specifically hypertension, diabetes, cardiovascular disease, lung disease, and cancer, as shown in this table. Mortality is also affected by age. Death is exceedingly rare below the age of 30 years and begins to climb in those over 60, being 4% for ages 60 to 69, 8% for ages 70 to 79, and 15 to 25% for those 80 or older. To summarize the content of this final video on the clinical characteristics of COVID-19, 80% of the time the disease is mild to moderate in severity, but patients can develop cytokine storm and ARDS, resulting in irreversible hypoxia and death. A higher mortality is seen in men, those 60 years of age or older, and those with underlying diseases. Overall mortality is 0.5 to 3.5%, or 5 to 35 times more deadly than influenza.